So you're having a hip arthroscopy done. So what we'll do is we'll start going through an informational packet to get information on post-op and pre-op instructions, as well as getting to know you and your health history. So the first thing I want to know is we're going to go through your past medical history as well as the medications that you're taking. Important medications to note that if you're taking would be anti-inflammatories, things that can thin your blood, like blood thinners, aspirin, fish oil, and any other medications that can suppress your immune system would be good to know of as well. So we can review those, a medication list with you, and tell you which ones to stop. We also want to know if you have any sort of rashes, scars, previous surgeries on the area that we're going. So typically that's in the groin area of the side that we're doing, the left or the right side. It's good for us to know if you've had previous scars or surgeries. Anything that comes up on the skin is good for us to know. It's important to identify post-op support systems, so someone that can be at home and take care of you when you get there, someone who understands this packet, knows the post-op instructions as well, and who can understand what it looks like, your recovery system looks like. That way you can have some support there if you need someone to help you make sure that you're doing okay. Some patients do need medical clearance, so if that's the case, we did ask you, Dr. Evanson asked you to get clearance prior to your surgery. We'll have you do that, so that's going over to Legion Orthopedic Hospital, getting lab work, a chest x-ray, EKG, making sure that you're fit to go under anesthesia. And so we like to have that done prior to your surgery to make sure that we can proceed. Since getting a hip arthroscopy, we do use a CT scan in surgery, so we get what we call a hip map. What this does, it shows us where your excess bony abnormality is that we can use in surgery to make sure that we have got all of that removed. So we have you get a CT prior to surgery. Now the CT scan does need to be completed about 3 to 4 business days prior to your surgery, if not earlier than that. So it's make sure that you get that before your surgery, and then make sure that we have that as well so we can review it. You'll make a 2 and 6 week post-op follow-up when you leave today. At 2 weeks, you'll come and see us. It'll be a quick wound check, and then 6 weeks we'll get x-rays, do more of an exam at that time. You'll also receive brace and crutches from our DME department today, and we'll be reviewing what the purpose of those are. And we'll give you a physical therapy script as well as a pharmacy, get your pharmacy information so we can send your medications ahead of time before your surgery. So now we'll move into risks of the surgery. So risks of the surgery does include blood clots. So we will put you on an 81 milligram baby aspirin twice a day for 30 days. We'll also send you compression devices. Those plasma flow compression devices will squeeze your calves when you're laying down and resting for long periods of time. We say usually wear them about 4 weeks after surgery. The more you're up and walking, the less you need to wear them, but good to wear when you're laying down for long periods of time. With those plasma flow devices, you'll be sent a TINS unit called the ManaFlex. The ManaFlex serves a purpose for pain. If you're having pain, you can put that on. It'll kind of distract the nerves, shock the nerves to help with pain. It also has a NIMS unit, which will help for muscle atrophy, which you can transition to when you're ready. You can have some numbness and tingling on the outside of your thigh after surgery. That is normal. That should resolve over time, but you may always have some numbness near your incision sites, and that is normal as well. Risk of heterotopic bone ossification, bone growth in the area of soft tissue. Small risk, but can happen, and we also put you on an anti-inflammatory to decrease that risk to less than 1%. Risk of recurrent labral tear or capsular insufficiency. So when we do this surgery, we will sew up the capsule that's in charge of kind of holding your joint nice and stable. If you were to fall, it can tear, so we tell you to stabilize that leg instead of falling. So you'll be on a brace and crutches for 3 weeks, and you'll essentially be about 20 pounds of weight on that foot, flat foot weight bearing. Although in places like the shower, you won't have crutches to stabilize yourself, so if you feel like you're going to fall, we suggest putting a little bit of weight on the foot instead of falling. You will also be in a brace to help stabilize that leg, and so we'll go over that a little bit more in detail, and you'll get that brace today. Risk of infection, so obviously your skin can get infected. We tell you not to soak your incisions for 6 weeks following surgery until they're closed. You can shower, just not submerge into water, lakes, pools, hot tubs, baths for about 6 weeks. This here is the brace that I've discussed. So you'll be wearing a hip brace for about 3 weeks. Sometimes this is longer, but we'll let you know if you're someone who ends up wearing it up to 6 weeks, but the routine is 3 weeks. The purpose of this hip brace, it limits you what to do. It helps you not flex past 90 degrees for those first weeks. The other thing, you'll be wearing crutches with this, so again, you'll be 20 pounds of weight on that operative foot, flat foot weight bearing, resting that foot nicely on the ground, relaxing the muscles. You will also come with an ice machine as well. You can use the ice machine as much as you can tolerate to fluctuate ice over the incision to help with pain and swelling. So you'll get fitted for this today, and important to bring to your day of surgery as well. This here is a post-operative guide that we'll go through. The first part of this guide talks about what you can expect after recovery. So it goes into a lot of detail about what to expect for each week. But the high notes talk about 0 to 3 weeks you're in a brace and crutches. After 3 weeks, you do get out of the brace and then you start to wean off the crutches. So by doing that, you're going to go from 2 crutch to 1 crutch to no crutch, putting more weight on that foot and making sure you don't have a limp. So we rely on physical therapy to help guide you do that and making sure you're not having a limp and causing any other issues. Once you don't have a limp, you can ditch the crutches and then start to walk normally without the crutches. At around 6 weeks, you can start doing aqua therapy, considering your incisions are closed. And then 10 weeks, we introduce elliptical if you're at that point. As well, at 12 weeks, you can start doing higher impact activity, so starting on a running program and slowly getting back into normal activity at that point. But again, read through this more in detail. It talks a lot about what the recovery process looks like. Next, we'll review post-operative medications. So these medications will be sent to you prior to your surgery, so you can pick them up at your pharmacy ahead of time. The only one that won't be given to you ahead of time is going to be the narcotic. That must be given to you on the day of surgery. So we do use a multimodal pain approach, so we approach pain from multiple different aspects. We have you take these medications here for the first 72 hours to stay ahead of your pain, those medications being Tylenol, gabapentin, which works on nerve pain, a muscle relaxant, and a stool softener. We have you take those again for the first 72 hours to stay ahead of your pain, then you can just take them as needed. There are 3 medications we do want you to take for 30 days following your surgery. One being naproxen, the anti-inflammatory, also preventing against HO. Next is omeprazole, protecting your stomach from 2 anti-inflammatories from asymptomatic GI ulcers. And then also aspirin, your blood clot prophylactic medication that you'll take twice a day for 30 days. We will give you a script for narcotic, oxycodone. We say use that for breakthrough pain, so that'll be your second line. We want you to use all those other medications for pain first. If you're still having pain, then you can reach for one of those, but again, our patients do well and usually don't need very many of them, if any at all. We will give you something for nausea and as well, in case you get nauseous, you'll have that for you there. Next, we will move into post-op instructions. So one thing that's very important about this surgery is to make sure you get on a stationary bike the day after surgery. So finding access to a stationary bike is usually very important prior to your surgery, so you can get a recumbent bike, an upright bike, a road bike, and stabilize that road bike. That's fine too. It doesn't have to be anything fancy, just something that can get motion in that hip. The instruction is making sure that you get on that bike the day after surgery, starting 5 minutes a day, working up to 20 minutes a day. You don't have to have resistance on that bike, just nice and easy, leading with the non-operative leg. And instructions on that are listed in the back of this packet as well. We will start you in physical therapy pretty quickly, about 3 to 5 days after your surgery. And we can help you pick a place that you feel comfortable going to. You will have a bandage over your incision. That bandage will stay on for 2 days. It's a large bandage to collect fluid. After 2 days, you can remove it. Underneath are going to be 3 small poke holes with 3 clear plastic band-aids on top. Those clear plastic band-aids are holding the skin together, so we ask you to keep those on for as long as you can. You can let soap and water run directly over those clear plastic band-aids. You pat them dry and then cover them with some other bandages to kind of protect those bandages from falling off. Now, if those clear plastic band-aids do fall off, you can remove them and replace them with normal bandages. But it's important that those incisions get washed daily and are washed and cleaned and dried and pressed with fresh bandages on top. In terms of driving, we ask you that you wait till you get out of the brace, so that can be around 3 to 6 weeks depending on how long you're in the brace for. So we say wait till you're out of the brace and then you can start driving, and can't be on narcotic pain medication as well. The next packet would be an exercise program packet. This is going to be the PT protocol that you'll give to your physical therapist. It's important that your physical therapist follows this protocol exactly. This will be very important to your recovery. So definitely hand this to wherever you go to physical therapy, as they can follow the instructions in this packet. You will have a form that specifies the day that you have surgery. Your check-in time will be given to you the day before surgery or the business day prior to your surgery. Other important things to do prior to your surgery would be to schedule physical therapy and already have that appointment so you can go following surgery within that first week. You also want to have your 2- and 6-week post-op appointments scheduled at our office, so we can see you at 2 weeks to check your incisions, as well as see you at 6 weeks to take x-rays and do an exam at that point. If you were someone who needed medical clearance or were deemed to get medical clearance, it's important that you have that done prior to surgery, at least 2 weeks, so we can make sure that you are fit to go under anesthesia and no other issues that we need to address. Medications to stop, we will review your medication list with you and discuss any medications to stop. In terms of over-the-counter medications, avoid anti-inflammatories 7 days before surgery, as well as blood thinners, things like fish oil and aspirin. Here we will list things to do prior to your surgery, so you don't want to eat anything after midnight, and other specifics that you can read here on your own. And then to surgery, we want you to bring your surgical packet with you, the brace that you'll receive, the ice machine, as well as crutches. If you have any questions, you can call our office and ask for Dr. Evanson's team, and we'd be glad to answer those for you.